Suture which join the parietal bone is frontal suture, sagittal suture, coronal suture, lambdoidal suture. The correct answer is B. Sagittal suture. A nurse should position patient recovering from general anesthesia in supine position, high forward position, side-lying position, Trendelenburg position. The correct answer is side-lying position. The common site for foreign body obstruction is pharynx, larynx, cricopharyngeal junction, pharyngolaryngeal junction. The correct answer is C. Cricopharyngeal junction. Poor housing condition can lead to dysentery, worm infestation, respiratory disease, water pollution. The correct answer is A. Dysentery. Which of the following is PEM? Beriberi, scurvy, kwashiorkor, dehydration. The correct answer is C. Kwashiorkor. Hot flushes are commonly seen to the woman during pregnancy, postmenopausal period, premenopausal period, postnatal mother. The correct answer is premenopausal period. The most common dose-limiting toxicity of chemotherapy is nausea and vomiting, bloody stool, myelosuppression, inability to ingest food orally due to stomatitis and mucositis. The correct answer is A. Nausea and vomiting. Which is the essence of mental health? Self-awareness, self-actualization, self-esteem, self-worth. The correct answer is B. Self-actualization. What is the most common problem in tube feeding? Diarrhea, infection, hyperglycemia, vomiting. Correct answer is A. Diarrhea. The most common cause of seizures for term and preterm neonate is malformation, perinatal asphyxia, pneumonia, meconium aspiration syndrome. Correct answer is B. Perinatal asphyxia. Which food should be given to a person suffering from nephrotic syndrome? High protein diet, low fat diet, NPO until cure, high calorie diet. The correct answer is A. High protein diet. A nurse is caring for a cancer patient receiving subcutaneous morphine sulfate for pain. Which of the following nursing action is most important in the care of this patient? Monitor urine output, monitor respiratory rate, monitor heart rate, monitor temperature. The correct answer is B. Monitor respiratory rate. The highest percentage of cervical cancer is found in squamous cell carcinoma, adenocarcinoma, mixed myometrial carcinoma. The correct answer is A. Squamous cell carcinoma. Withdrawal symptoms of steroid dependence include restlessness, mood disorder, insomnia, all of the above. The correct answer is D. All of the above. When providing post-operative care for the child with a cleft palate, the nurse should position the child in which of the following positions? Supine, prone, in an infant seat, on the side. The correct answer is B. Prone. Which finding might be seen in baby neonate suspected of having an infection? Flushed cheeks, increased temperature, decreased temperature, increased activity level. The correct answer is B. Increased temperature. The best implication that a patient with diabetes mellitus is successful managing the disease after discharge is a reduction of excess body weight, stabilization of serum glucose level, demonstration knowledge of disease, compliance with the order for insulin administration. The correct answer is stabilization of serum glucose level. Foramen magnum is found in skull, hip joint, shoulder joint, brain. Correct answer is A. Skull. Which of immunity is transferred to the fetus through the placenta? Active natural immunity, passive natural immunity, active artificial immunity, passive artificial immunity. The correct answer is B. Passive natural immunity. All of the following are aim of first aid except to preserve life, to prevent further damage, to cure the disease infirmity, to promote recovery. The correct answer is C. To cure the disease infirmity. Most common channel of communication is face-to-face, folk dances, dramas, mass media. Correct answer is A. Face-to-face. Taking out a small piece of tissue for diagnostic purpose is known as biopsy, dissection, reconstruction, extraction. Correct answer is A. Biopsy. How long the rectal thermometer is inserted to adult client's anus? 1 to 2 inches, 0.5 to 1.5 inches, 3 to 5 inches, 2 to 3 inches. The correct answer is C, 3 to 5 inches. When palpating the client's breast, which of the following position is necessary for the patient to assume before starting of the procedure? Supine, dorsal recumbent, sitting, lithotomy. The correct answer is C, sitting. Opioid analgesic poisoning should be treated with atropine, flumazenil, naloxone, charcoal. The correct answer is C, naloxone. In physiology of labor, mechanical factor of labor include the following acid: formation of the forewater, formation of upper and lower uterine segment, general fluid pressure, fetal axis pressure. The correct answer is B, formation of upper and lower segment. IUD insertion is not recommended in all except immediate after second trimester, newly parous woman having multiple delivery, 6 to 8 weeks after delivery. The correct answer is D, 6 to 8 weeks after delivery. Which of the following has largest diameter? Mento-vertical, occipito-frontal, sub-occipital pragmatic, sub-occipito-frontal. The correct answer is A, mento-vertical. The positive sign of second stage of labor is expulsive uterine contraction, rupture of the forewater, tinking of blood, no cervix felt on vaginal examination. The correct answer is D, no cervix felt on vaginal examination. Contraceptive of choice during first 6 months following delivery is oral contraceptives, conventional, DMPA, no need because of lactational amenorrhea. The correct answer is D, no need because of lactational amenorrhea. White part of the egg has highest amount of fat, protein, vitamin, minerals. The correct answer is B, protein. Outermost membrane is amnion, yolk sac, chorion, trophoblast. Correct answer is C, chorion. The examination is done by facing towards the patient. Fetus frontal grip, lateral grip, pollex grip, pelvic grip. Correct answer is D, pelvic grip. The structure that bypasses the right ventricle is ductus venosus, foramen ovale, ductus arteriosus, umbilical vein. Correct answer is B, foramen ovale. While assessing a child with pyloric stenosis, the nurse is likely to note which of the following: regurgitation, steatorrhea, projectile vomiting, current jelly stools. The correct answer is C, projectile vomiting. If a newborn baby develops jaundice within 24 hours of birth, it is hemolytic jaundice, physiological jaundice, obstructive jaundice, aplastic jaundice. The correct answer is A, hemolytic jaundice. Vector for transmission of dengue fever is Culex, Aedes, Anopheles, housefly. The correct answer is B, Aedes. Which of the following characteristic of the amniotic fluid would cause an alarm to the nurse? Greenish, scanty, colorless, blood stained. The correct answer is A, greenish. The nurse observes a 2-year-old at play and notes that this age toddler builds house with blocks, is extremely possessive of toys, attempts to stay within the line when coloring, assumes self with a picture book for 15 minutes. The correct answer is A, build house with blocks. Crackpot or McQueen's sign is seen in microcephaly, hydrocephalus, rickets, Wilson's disease. The correct answer is B, hydrocephalus.
Which of the following condition in fetus is associated with polyhydramnios, IUGR, post-maturity, esophageal atresia, low birth weight? The correct answer is C, esophageal atresia.
A condition where one side of the body is paralysis is called paraplegia, quadriplegia, monoplasia, hemiplasia. Correct answer is D, hemiplasia. High concentration of oxygen administration in premature infants can cause oxygen toxicity, retrolental fibroplasia, apnea, respiratory distress syndrome. The correct answer is B, retrolental fibroplasia. What should the nurse teach a client who is taking antihypertensive to do? Minimize orthostatic hypotension. Wear supportive shoes continuously. Lie down for 30 minutes after taking medication. Avoid tasks that require high energy expenditure. Sit on the edge of the bed for 5 minutes before standing. The correct answer is sit on the edge of the bed for 5 minutes before standing. Main reservoir of circulator blood, arteries, vein, capillaries, left ventricle. Correct answer is B, vein. Duration of action of sublingual nitroglycerin tablet is 1 to 2 hours, 2 to 3 hours, 10 to 30 minutes, 3 to 5 minutes. The correct answer is D, 3 to 5 minutes. Which of the following closes and seals of the lower airway during swallowing? Alveoli, epiglottis, larynx, uvula. The correct answer is B, epiglottis. Which cells in the blood do not have a nucleus? Lymphocyte, monocyte, erythrocyte, basophil. The correct answer is C, erythrocyte. Which of the following part of vertebral column has 5 vertebrae? Thoracic, cervical, lumbar, sacrum. Correct answer is C, lumbar. The full form of COPD is chronic obstructive pulmonary disease, chronic observation pulmonary disease, currently obstructive pulmonary disease, care obstructive pulmonary disease. The correct answer is A, chronic obstructive pulmonary disease. According to nursing process, what do you do first during the plan of nursing care? Set the goal and objectives, prioritize the problem of clients, assess the problem of patient, evaluation of provided care. The correct answer is C, assess the problem of the patient. Remittent fever is seen in typhoid fever, rheumatic fever, TB, malaria. Correct answer is A, typhoid fever. Deep breathing and coughing exercise will be contraindicated in abdominal surgery, thoracic surgery, facial surgery, eye surgery. The correct answer is B, thoracic surgery. All are symptoms of drug addiction except impaired memory and concentration, excessive appetite, slurring of speech, clumsy movement and tremors. The correct answer is B, excessive appetite. HIV antibodies usually take to appear in the blood stream after the infection. 2 months, 6 months, 12 months, 24 months. The correct answer is A, 2 months. Which of the following parts are most affected by electric burn? Nervous system, heart, liver, kidney. Correct answer is A, nervous system. Severe vomiting may be the cause of metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Correct answer is B, metabolic alkalosis. Quickening is the positive sign, presumptive sign, probable sign, all of the above. Correct answer is B, presumptive signs. All of the following are fetal complications of the placental previa except intrauterine death, malpresentation, low birth weight, congenital malformation. Correct answer is B, malpresentation. Commonest cause of oligohydramnios is pre-labor rupture of membrane, premature rupture of membrane, amniotic fluid nodulorum, both A and B. The correct answer is both A and B. Most important immediately care of a newborn is keep warm, clear airway, cutting, breastfeeding. The correct answer is clear airway. Perinatal mortality not includes except stillbirth, neonatal death, stillbirth and early neonatal death, stillbirth and neonatal death. The correct answer is C, stillbirth and early neonatal death. Kegel's exercise is done to prevent sexual transmission infection, postpartum hemorrhage, antepartum hemorrhage, pelvic organ prolapse. The correct answer is D, pelvic organ prolapse. All of the following includes Basic Essential Obsteric Care, BOS, except manual removal of placenta, resuscitation of newborn, administration of parenteral drugs, blood transfusion. The correct answer is D, blood transfusion. Normal birth weight of baby is 3000 gram, 2500 gram, 3500 gram, 4000 gram. Correct answer is B, 2500 gram. Fundal massage helps to control infection, contraction of uterus, involution of uterus, both A and B. Correct answer is B, contraction of uterus. According to WHO, the daily requirement of iodine during pregnancy is 100 mcg, 150 mcg, 170 mcg, 200 mcg. The correct answer is D, 200 mcg. Immediately after descent of weight, the next action is engagement, flexion, restitution, extension. Correct answer is flexion. All of the following abortions are not dilated cervical oars except threatened abortion, missed abortion, incomplete abortion, complete abortion. The correct answer is C, incomplete abortion. During pregnancy, use of folic acid has reduced the risk of mental retardation, anemia, eclampsia, neural tube defect. The correct answer is D, neural tube defect. Physiology: anemia seen in mother during pregnancy is due to low iron level, womb infestation, increased plasma volume, vomiting. correct answer is C. Increased plasma volume. Puerperal sepsis is commonly developed immediately after delivery, 24 hours after delivery, 2 weeks after delivery, in any time after delivery. The correct answer is C. 2 weeks after delivery. Chance of transmission of HIV/AIDS from mother to child from breast milk is 20 to 25%, 15 to 20%, 15 to 25%, less than 5%. Correct answer is B. 15 to 20%. PIH is defined if there is presence of hypertension during pregnancy, after 20 weeks of gestation, during the time of labor, before 20 weeks of gestation. The correct answer is B. After 20 weeks of gestation. All of the following are the sign of ectopic pregnancy except pallor, tachycardia, hypertension, vomiting. Correct answer is D. Vomiting. Drugs which induce sleep: emetics, anxiolytics, sedatives, hypnotics. Correct answer is D. Hypnotics. Stage of GAS characterized by adaptation: stage of alarm, stage of resistance, stage of homeostasis, stage of exhaustion. Correct answer is B. Stage of resistance. Important nursing intervention for a client having a tonic seizure: maintain patient airway, restrain the client, put airway, insert Foley catheter. Correct answer is A. Maintain patent airway. Lithium is drug of choice to treat mania, anxiety, depression, schizophrenia. The correct answer is A. Mania. Which is not indication of ECT: organic illness, depression, suicidal tendency, postpartum depression, catatonic schizophrenia. The correct answer is A. Organic illness. Which is not mood stabilizer: sodium valproate, haloperidol, lithium carbamazepine. The correct answer is B. Haloperidol. The most common indication of ECD is schizophrenia, generalized anxiety disorder, manic episode, major depression. Correct answer is D. Major depression. In Nepal, the commonest mental disorder is psychosis, neurosis, depression, mental retardation. The correct answer is B. Neurosis. यस्तै भिडियोको लागि मेरो च्यानललाई सब्स्क्राइब गरिदिनु होला, त्यसैगरी यो भिडियो लाइक गर्न नभुल्नु होला। थ्याङ्क यू।